Day in the life of the service at IEMS is sheer chaos. And we love that and we thrive on that. Seizures to cardiac arrest to overdoses to stabbing, shootings. We see it all within this city.
What people don't realize is we are much more than just you call 911, we show up lights and sirens and save the day. We are a huge aspect of public health. We bridge a big divide because our feet are actually on the ground.
This is one of the only jobs in the world that strangers will hand over their child to you without even knowing your first name. And you have to realize that that is a huge responsibility.
We use the ambulance services almost as a vehicle, if you will, to recruit folks who are committed to building a better community, to building a better world around them, to building a better version of themselves.
I take pride in serving the community of downtown, take pride in serving the community up north. I just love working for Indianapolis IEMS.
Day one of EMT school and they tell you you're going to be around sickness and death and just the worst days for those individuals in need, but you have to be the calm in the storm and persevere.
It's not about all the bloods and guts and the gore and the bad car wrecks and the gunshots and the stabbings. You guys will soon very quickly realize that this is about taking care of people.
When I got my letter in the mail said I was a certified EMT, that's when I knew, hey, this is it. That's what I'm going to do. Every day I learn something different.
We use education as a way to connect, and I think that's incredibly important because it is not only so valuable for our community and for our partners, but it's valuable for us to be the very best versions of ourselves we can.
So you feel the scalp, is there anything deformed? Then you just go down the chest, again check the abdomen and the back. Because it is a really big commitment as a new student to get into EMS education. It's a lot of anatomy and physiology initially, and it's very hard, it's very rigorous, and I would just want them to know that it is absolutely worth it.
This is a field that will either chew you up and spit you out, or it will swallow you whole and you will stay here for a very long time. I absolutely love what I do. It is very rare that I consider my job a job. Are you allergic to any medications? Very few places that you have such a dynamic work environment where teamwork honestly will define the outcome.
You can see life and death all within the same shift. And I've had it happen. You can give birth to a baby on one call, and the next call could be you're trying to save somebody's life.
How many people can say, yeah, I delivered this baby, it was healthy, I managed 2 patients at the same time, and it was awesome. Like, I'm sorry.
I think a lot of people think that when they start in this field that you get to run emergent on runs and you get to go fast and you get to help people out, but there's more to it. The area that you serve is truly your community and your people and your family.
If I can turn their day around, if they're having a very bad day, by the time we get them to the hospital, they're laughing or they're feeling a lot better. I take pride in that. We have to be very patient and be very calm.
Most of us that have been here for so many years can't imagine doing much else.
We want to leave a legacy, if you will, and we want to give. And EMS for us is the way that we do that. This is our way of giving and contributing back to the world.
We see some of the most terrible things in the world, but we also see some of the most remarkable successes. That is what keeps me coming to work, knowing that maybe 1 out of 100 runs, I truly save a life.